Imagine being on a critical cross-country drive, your entire life packed into a massive trailer towing your car while your family flies ahead, trusting you to meet them. You're hundreds of miles from home, navigating obscure back roads, when suddenly a terrifying crisis unfolds. Your eyes, already feeling uncomfortably dry and sticky, blink, and in that agonizing moment, your cornea rips. The world blurs into searing pain, rendering one eye almost useless, forcing you to steer a giant vehicle with severely impaired vision. This wasn't just discomfort, it was a debilitating emergency that brought my journey to a screeching halt. Desperately, I pulled into a tiny, unfamiliar town, hoping a few hours of sleep at a local Motel 6 would miraculously mend my eye. But the nightmare replayed. Upon waking, I opened my eye only for it to rip again. It was a Saturday, doctor's offices closed, and I was stranded, effectively half-blind, with a critical deadline to reunite with my family. Desperate, I stumbled down the street, searching for medical help. Against all odds, an eye doctor's office appeared. Relief quickly turned to despair when staff informed me they couldn't see me until Monday. That wasn't an option. I had to get back on the road. I explained the urgency, and the doctor, understanding the gravity, provided crucial numbing drops, allowing me to regain just enough vision to safely continue my drive. This harrowing ordeal, I later discovered, was a severe case of dry eye, directly linked to a profound vitamin A deficiency. My diet at the time, laden with junk food, had critically depleted this essential nutrient, making my corneas so fragile they tore. Beyond dry eyes, a lack of vitamin A can also cause night blindness, making vision difficult in low light. While poor dietary choices are a frequent cause, issues with the gallbladder, vital for absorbing fat-soluble vitamins, can also hinder the body's extraction of vitamin A from food. Active vitamin A, known as retinol, is primarily found in animal sources like egg yolks, liver, butter, and cod liver oil. It's a common misconception that plant-based beta-carotene provides sufficient vitamin A. However, its conversion into usable retinol in the body is highly inefficient, meaning one would need to consume vast quantities of vegetables for minimal active vitamin A. Furthermore, zinc is absolutely essential for vitamin A to function properly. Even with adequate vitamin A intake, a concurrent zinc deficiency can render it ineffective. Zinc is abundant in red meat, oysters, shellfish, and liver, but its absorption is significantly hampered by diets high in refined foods and sugars. This personal saga dramatically illustrates how deeply interconnected our nutrition is with our most vital senses, transforming a routine journey into a profound lesson on the critical role of specific nutrients in maintaining optimal health. Beyond the immediate crisis of dry eye, our vision can be compromised by underlying conditions often connected to overall health and dietary choices. One serious condition is retinopathy, particularly diabetic retinopathy, a leading cause of vision loss among diabetics. This impacts the retina, the crucial light-sensitive tissue at the back of the eye, an extension of the brain, responsible for capturing visual information. In diabetes, persistently high glucose levels inflict significant damage, creating rusting or oxidation within the delicate nervous system, leading to extensive free radical damage that degrades the retina, impairing vision. Fortunately, a powerful natural antidote to this oxidative stress exists: benfotiamine. This unique fat-soluble form of vitamin B1 is specially formulated to penetrate nerve tissues effectively, offering robust defense against high blood sugar's ravages. Benfotiamine has shown remarkable promise in mitigating many debilitating complications of diabetes, including peripheral neuropathy and diabetic retinopathy. By acting as a potent antioxidant, it actively combats free radical damage and provides critical support to the nervous system, enhancing blood flow to the nerves, especially in the retina. This improved nourishment and protection can significantly slow the progression of diabetic eye disease, highlighting the profound impact of targeted nutritional interventions. Another common, often perplexing visual disturbance involves floaters, those shadowy specks or cobweb-like strands that drift across our field of vision. These are not optical illusions, but physical remnants within the vitreous humor of the eye, largely caused by glycation. This occurs when proteins bond with sugar, creating sticky, dysfunctional compounds that accumulate. These aggregated proteins are precisely what floaters are. Addressing floaters often begins with fundamental dietary changes. Adopting a low-carbohydrate diet can significantly reduce the sugar available for glycation, preventing new floaters and potentially diminishing existing ones. For some, a stricter approach like a carnivore diet for 1 to 2 months might be beneficial in resetting metabolic pathways and aggressively reducing glycation. Beyond diet, the body possesses an incredible natural self-cleaning mechanism called autophagy. This process involves the systematic recycling of damaged cellular components, including accumulated proteins like those that form floaters. The most effective way to activate and enhance autophagy is through various forms of fasting. This is why intermittent fasting, where eating is restricted to specific windows, is highly recommended for those dealing with floaters. For more stubborn floaters, prolonged fasting can trigger deeper levels of cellular recycling, helping the body to clean up these troublesome visual obstructions, offering a non-invasive path to clearer vision. These strategies emphasize how our lifestyle directly impacts the intricate workings of our eyes. Shifting our focus to another pervasive threat to vision, we must address macular degeneration, a condition often labeled age-related. This designation, however, warrants critical examination, as not everyone inevitably develops this debilitating condition with increasing age, suggesting that age alone may not be the sole or primary cause. The macula is a small, highly sensitive central area of the retina, responsible for sharp, detailed vision, crucial for tasks like reading and recognizing faces. Its degeneration leads to blurred or absent central vision, profoundly impacting quality of life. Various factors contribute, from pervasive blue light emitted by LED screens, smartphones, and laptops, which causes retinal stress, to well-known culprits like alcohol, smoking, and excessive sugar intake, all contributing to systemic inflammation and oxidative damage. However, one of the most significant and often overlooked contributors, as highlighted by specialists in eye diseases, is the widespread presence of industrial seed oils in our modern diet. These highly processed, polyunsaturated fats, corn, soy, sunflower, canola, tend to lodge within cellular membranes, particularly in delicate eye tissues, where they can remain for years. The core problem is that these oils are frequently rancid and highly inflammatory, contributing to chronic oxidative stress. Anything that increases inflammation, especially high omega-6 fatty acids found abundantly in seed oils, will contribute to the degeneration not just of the macula, but other critical parts of the eye as well. The primary antidote is to drastically reduce or eliminate seed oils and increase beneficial omega-3 fats found in sources like fatty fish. Furthermore, nature offers powerful protective compounds against macular degeneration: 3 essential carotenoids, lutein, zeaxanthin, and mesozeaxanthin. These vital pigments act as natural filters, absorbing harmful blue light and neutralizing damaging free radicals within the macula. Excellent dietary sources include a vibrant array of green leafy vegetables, kale, spinach, yellow and orange fruits and vegetables, corn, bell peppers, carrots, nutrient-dense egg yolks, various seafoods, salmon, shrimp, and even meat from grass-fed animals, which contain significant carotenoids due to their natural diet. Macular degeneration is the second leading cause of blindness in adults, underscoring the urgency of these dietary and lifestyle interventions. By consciously increasing these protective compounds, we hold the potential to significantly improve and preserve our vision, taking a proactive stance against this debilitating condition. Moving to another critical eye condition, glaucoma is characterized by abnormally high pressure within the eye. This elevated intraocular pressure, if left unaddressed, exerts damaging force on the optic nerve and the sensitive retina at the back of the eye, eventually leading to irreversible vision loss. Recent research, including insights from an ophthalmologist specializing in this field, points towards promising alternative approaches, particularly involving vitamin D. This doctor highlights that current normal blood values for vitamin D are severely outdated, often considering levels below 20 nanograms per milliliter as merely deficient, when in reality, optimal health demands far higher concentrations for specific conditions. For glaucoma, he recommends aiming for vitamin D levels between 100 to 150 nanograms per milliliter. The rationale behind such high dosage recommendations is rooted in growing evidence suggesting that glaucoma may actually be an autoimmune disease. If this is true, then to effectively manage and potentially resolve the condition, one needs substantial doses of vitamin D to break through the resistance of the immune system and achieve a therapeutic effect. This perspective offers a new paradigm for understanding and addressing glaucoma, moving beyond solely pressure-reducing medications to exploring the systemic influence of critical nutrients on ocular health. Finally, we turn our attention to cataracts, a common condition involving the clouding or opacification of the eye's natural lens. This cloudiness significantly impairs vision, making it blurry, hazy, or less colorful, much like looking through a frosted window. The underlying cause of cataracts is often the development of sticky, non-functional proteins within the lens, a process frequently accelerated by the chronic consumption of sugar. Just as sugar can lead to glycation and floaters, it can also cause proteins in the lens to clump together and become opaque. The antidote, similar to glaucoma and other eye conditions, involves higher amounts of vitamin D, crucial for overall ocular health and cellular protection. Additionally, specific remedies show promise, such as N-acetylcarnosine eye drops, if available, which contain potent antioxidants that can help protect the lens from oxidative damage and potentially reverse early cataract formation. Zinc, another vital mineral, also plays a significant role due to its antioxidant properties and involvement in numerous enzyme systems that protect the eye. In essence, any food rich in antioxidants provides a shield for the eyes. This is why consuming vegetables and fruits with vibrant, dark purple, red, orange, or yellow pigments like berries, bell peppers, carrots, or leafy greens is so beneficial. These pigments are natural antioxidants that combat the free radical damage and oxidative stress contributing to conditions like cataracts. By embracing these nutritional strategies, you empower yourself with knowledge and proactive steps to safeguard your vision against these prevalent eye conditions, fostering long-term eye health.